Hello guys, welcome to our presentation. So today we will present lesson 10, surgical procedure. We are group 4, class YK16A, and our member have Phan Minh Hoàng, Lê Sĩ Hùng, Nguyễn Thị Hiền, and Đinh Thị Hiệp Hòa. Now let's move to the new word. So the first word is surgical procedure. When you do a procedure by cutting open the body and remove or repairing the damaged part, you say surgical procedure. In Vietnamese, it means thủ thuật ngoại khoa. The next word is urgent. When something needs attention very soon, especially before anything else, because it is important. In Vietnamese, it say khẩn cấp. The next is emergent. When something dangerous or serious, such as an accident that happens suddenly and unexpected, and it needs to fast action in order to avoid harmful results. In Vietnamese, you can say it's cấp cứu. The next is cosmetic surgeries. So anything medical operation that is intended to improve a person's appearance rather than their health. In Vietnamese, it say phẫu thuật thẩm mỹ. So the next is cataract. It is a disease which an area of someone's eye becomes less clear, so that they cannot see clearly, or the area affected in this way. In Vietnamese, this means nhục thủy tinh thể. So the cyst is a round mass growing just under the skin or deeper in the body that contains liquid. In Vietnamese, it means nang hoặc là áp xe. Appendicitis is an illness which the appendix is infected and painful, usually need to be removed in operation. So Vietnamese, it means viêm ruột thừa. Inflammation. When you have an inflammation, the area often red, sore, and swollen because of infection. In Vietnamese, it means viêm. Pre-operative is a period of time before a medical operation, and intraoperative is a time during a medical operation, and the post-operative is a time after the operation. So, anesthesiologist is a medical specialist who gives anesthesia during an operation, and anesthesia is a condition of not feeling pain by using special drug. Anesthetist is a special drug that makes the body unable to feel pain. Anesthesiologist in Vietnamese means bác sĩ gây mê. Anesthesia means sự gây mê. Anesthetist means thuốc mê. Medication. A medicine or a set of medicines or drugs used to improve a particular condition or illness. In Vietnamese, it means liều thuốc. Consciousness is a state of understanding or realizing something, or you can say awareness. In Vietnamese, it means tri giác, tri thức. Scrub nurse. The nurse is an expert in operative nursing and assists the surgeon during surgeries. It is a điều dưỡng vòng trong. And calculating nurse is a nurse who makes preparation for an operation, who works in the operating room outside the sterile field, which is a operation room. In Vietnamese, it means điều dưỡng vòng ngoài. The resident is a doctor who's still in training and who works in the hospital. The intensive care unit is a unit that provides a continuous treatment for patients who are seriously ill or very bad injured or who have a certain operation. The last is ventilation. When you do something to cause fresh air to enter and move around a closed space, such as lungs, you say ventilation. In Vietnamese, it means sự thông khí. Now, let's move to the reading. So, you guys are already read the test in Lesson 10 Surgical Procedure, page 84. So, we will pass this and move to the next part, comprehension. So, let's do exercise 2.1. Answer the following question. The first, why is nasoplastic surgery considered as optional? The answer is because nasoplastic surgery is a type of cosmetic surgery which are not required, but the patient chooses to undergo. Number 2. What is the difference between urgent surgical procedure and emergency procedures? So, urgent surgical procedures are performed when a patient condition is not immediately life-threatening, but failure to treat it may result in death. Emergency procedure must be performed within a few hours of a patient's arrival at hospital to prevent death. Number 3. Why low blood pressure is a sign worthy of finding before giving anesthesia? Because low pressures are one of the signs which makes the administration of anesthesia dangerous. Number 4. Do all medical students have permission to attend an operation? No, they don't. Depending upon the hospital, medical students may attend an operation. Number 5 is the last. What is the type of ICU or intensive care unit? So, the type of ICU is to monitor blood pressure and heart rate and provide supplemental oxygen, mechanical ventilation for the lung, and physical support under critical circumstances. Now, let's move to exercise 2.2. Indicate which of the following are false. The first, case requiring surgery cannot be cured with the use of medicine. True or false? It's true. Next, with the delay of an emergency procedure, a case of mortality may result. It's true. Number 3. An anesthetist needs to know what kind of medicines and the patient have used in order to give the right anesthesia. It's true. The scrub nurse is in charge of providing the right instrument for surgery. It's true. The last, after the operation, all patients are carried to the ICU for a special care unit that gain consciousness. Yes, it's false. So exercise 2.3. Choose a suitable word to complete the sentence. Number 8. The answer is optional surgery consists of operations that are not required, but which patients choose to undergo, as with some types of cosmetic surgeries. B. Which one is the right answer? Oh, it's urgent. Surgical procedures are performed when a patient's condition is not immediately life-threatening, but failure to treat it may result in death. C. Yeah. Emergency procedure must be performed within a few hours of a patient's arrival at hospital to prevent death. D. Yes, pre-operative care includes routine checks of vital signs, include temperature, pulse, blood pressure, analysis of blood and urine, and physical examination to evaluate organ function. E. Yeah. An anesthesiologist look for signs that make the administration of anesthetic dangerous, such as chest infection or low blood pressure. F. Yeah. A surgeon generally will consult the patient and his or her families about the surgery and what to expect after the operation is performed. G. The surgeon determines the timing of the operation and technique and the instrument and supply to be used. H. Yeah. The anesthesiologist controls the patient's pain. E. Yeah. Depending upon the hospital, surgical assistant, physician assistant, surgical resident, medical student, and nursing student may also attend an operation. Now, let's move to exercise 2.4. So, I will give you the answer, and so we can quickly pass this. The various surgical procedures mentioned in the passage are classified as optional, required, elective, urgent, and emergent. B. Urgent surgical procedures are performed when a patient's condition is not immediately life-threatening, but failure to treat it may result in death. C. To prevent death, emergency procedures must be performed within a few hours of a patient's arrival at hospital. D. Major wounds, blockage of intestines, or appendicitis are serious life-threatening conditions which are corrected by emergent procedures. E. Temperature, pulse, on blood pressure are vital signs. F. Analysis of blood and urine and physical examination are made to evaluate organ function. G. To make surgery more tolerable and to ensure that the patient regains consciousness safely and quickly following the operation. The patient's pain and the level of consciousness are controlled by the anesthesiologist. H. The scrub nurse, ready or instrument ensure the sterility of surgical fields and anticipates when instrument will be needed by the surgeon. Number I. The calculation nurse Make sure the operating room is up, attend quality supply and provide any additional supply to the scripter during operation. J. Most operative care begin to a recovery room or intensive care unit (ICU). Next is exercise 2.5 multiple choice. So you have to do each choice the correct answer. Number 1. When saying patients with some form of cancer are often considered as urgent surgical case, the writer wants to say that A. They must be operated within 1 month of a patient arrival at hospital. B. They must be operated as soon as possible. C. They may die if not treated. So the correct answer is C. They might die if not treated. 2. Pre-operative care reduces the risk of complication. A. Before a surgical operation. B. After a surgical operation. D. During and after operation. Yes, the correct answer is C. During and after a surgical operation. So let's move to the language focus. The first is use the use of some. Some is used to mean quite a large amount of or number. For example, you say, I did not meet her for some years, or it took some years for Mr. Kennedy to realize the truth. In this case, some mean một vài hoặc là nhiều. So, some can also be used in front of a number to show that you are not being totally accurate. For example, you say, it was some 15 km by sea from the nearest village. In this case, some means xấp xỉ. When you want to emphasize that you do not know the identity of a person or thing, or when you think they identify is not important, you can use some with a singular cause noun instead of an or a. For example, you can say most staff members will spend a few weeks in some developing country. Patients with some form of cancer are often considered urgent surgical case. In this case, some mean một cái nào đó. Thì khi muốn dùng thì chúng ta sẽ nói đến một cái thông tin chính xác mà điều này đang nhắc đến. So we will move to the use of might. You can use could, might, or may to say there is a possibility that something is happening. The might is slightly more formal than could or might. Otherwise, there are very little difference in meaning between the model. For example, I say, an anesthesiologist look for a sign that may make the administration of anesthetic dangerous, such as chest infection or low blood pressure. Don't eat it, it could be poisonous. He might have been sick. In great case, the jaws may be broken during extraction. That mustn't be true. So in this case, trong trường hợp này thì could, may, might và cộng với một infinity thì nó chỉ vào một khả năng có thể xảy ra trong hiện tại nhưng mà không chắc chắn. Nhưng mà could hoặc might thì khi dùng nó sẽ cho một cảm giác lịch sự hơn là may. Now we study also possibilities and it may be that. So when you notice how the doctor expressed the idea that the possible cause of the patient's nosebleed were his high blood pressure, the doctor will say, It may be that the high blood pressure causes your nose bleed. So, trong trường hợp này thì chúng ta sử dụng nó để diễn tả một khả năng có thể xảy ra, thì chúng ta có thể áp dụng công thức là could, may, might cộng với have participle, hoặc là có thể sử dụng it may be that hoặc là perhaps chủ ngữ cộng với verb past simple, hoặc là cộng với một has verb past participle. So we use the so you will do some exercise to remember what we have studied. So the first, he may have taken an overdose. So you can say it may be that he had taken an overdose. So B, you may have said the fractal incorrectly, and you can say it may be that you have said the fractal incorrectly. C, perhaps the band were due to hysteria. You can say maybe that hysteria caused the bands, or you can say it may be that the band were due to hysteria. Yeah, it's same. D, perhaps the cause of raised blood pressure were arteriosclerosis. Yeah, you can say it may be that arteriosclerosis caused raised blood pressure. And the last, the patient may have damaged her skin deliberately, as sometimes happens in neurodermatitis. Yeah, you can say it may be that the patient have damaged her skin deliberately, as sometimes happens in the neurodermatitis. Easy, right? So let's move to the exercise 3.4. Complete the following sentence with the words given: but, may, must, some, this, will, and when. So I will give you the answer now. So the elective surgical procedure usually involves conditions that may not require surgery, but in which surgery will have a favorable effect, such as the removal of small cysts. Urgent surgical procedures are performed when a patient's condition is not immediately life-threatening, but failure to resist may result in death. Patients with some form of cancer are often considered the urgent surgical case. Emergency procedures must be performed within a few hours of a patient's arrival at hospital to prevent death. The surgeries correct serious life-threatening conditions such as major wounds, blockade of intestines, or appendicitis. Is the inflammation of the appendix. So that's all of our presentation. Thank you for your attention, and I apologize for my bad pronunciation. That's all. Thank you, you all. Love you.